Hi, I'm Anne Star, a registered dietitian at Cooper University Healthcare, and I'm here to talk to you about nutrition, specifically for those of you managing chronic conditions as you transition to adult healthcare. Whether you're dealing with diabetes, ADHD, depression, asthma, Crohn's disease, or other ongoing health conditions, understanding how food impacts you is one of the most powerful tools you can have as you take control of your own health. So, let's make this practical for your real life. If you have diabetes, you already know what you eat directly impacts your blood sugar levels. But did you know that consistent meal timing can be just as important as what's on your plate? For those of you with ADHD, certain foods might affect your focus and medication effectiveness. If you're managing depression, you might notice that skipping meals makes your mood worse, or that some foods make you feel more stable. With inflammatory conditions like Crohn's, food can be both a trigger, but also a source of healing. The key is figuring out what works specifically for your body and your condition. Here's something that will make you feel more powerful in managing your condition. Keep a food diary, along with symptoms. Track what you eat and how your condition responds. Do certain foods trigger your condition, affect your mood, or cause flare-ups? This isn't just helpful information for you, it's invaluable information for your healthcare team. You're becoming the expert on your own body, and this data proves it. When you're managing a chronic condition, energy crashes aren't just inconvenient, they can make everything harder. Focus on foods that give you steady energy. Lean proteins, whole grains, and vegetables. These foods help to keep your blood sugar stable, which helps your body manage whatever you're dealing with more effectively. For quick snacks, pair a protein with a complex carbohydrate, like Greek yogurt with berries, apple slices with almond butter, or hummus with vegetables. These combinations support both your energy and your condition management. Now, let's talk about something crucial: how caffeine interacts with your condition and medications. If you're taking stimulants for ADHD, that energy drink with 300 milligrams of caffeine could put you over the edge. If you have anxiety or take certain antidepressants, too much caffeine can worsen your symptoms. Those energy drinks also pack 14 teaspoons of sugar, which can spike your blood sugar if you have diabetes or trigger inflammation if you have Crohn's. Check with your healthcare team about caffeine limits for your specific medications and conditions. Your body is already working harder. Don't make it work against you. If your condition requires avoiding certain foods, focus on what you can add, not just what you're taking away. Can't have gluten due to celiac or sensitivity? Quinoa, rice, and oats may be your new best friends. Need to limit sodium for blood pressure? Herbs and spices can make your food more flavorful than salt ever could. The point is, easy alternatives and substitutions are just a Google search away. As you transition to adult healthcare, you need to be ready to advocate for your own nutritional needs. Your new healthcare providers can help you understand how nutrition affects your specific condition, but they'll also need to know what you've been eating and how you've been feeling. So come prepared. Bring your food diary, ask specific questions about nutrition and your medications, and request referrals to registered dietitians who specialize in your condition. Managing a chronic condition while becoming an independent adult isn't easy, but understanding your personal nutrition needs gives you real power. Start where you are. Maybe it's tracking how food affects your symptoms for a week. Or have that nutrition conversation with your healthcare team. Or make one food swap to help reduce your symptoms. You're not just managing your condition, you're building a lifetime of health knowledge. Trust yourself, advocate for what you need, and remember that small, consistent changes can have a huge impact on how you feel. You got this, and remember, we're here to help you when you need it.